Hey guys, welcome to the Dunn Wisdom Show. I am your host, Melissa P. Dunn, public servant, award-winning entrepreneur, and personal brand strategist. Now, each week, I love sitting down with change makers, trailblazers, and leaders who embody courage, integrity, and wisdom in action. And today's guest does just that. I'm sitting down with Mario Orentes, who is a registered nurse with over 17 years of experience across long-term care, hospice, home health, integrated primary care, and case management. He currently serves as a Senior Director of Core Coordination at Banyan Community Health Center, where he leads programs dedicated to improving patient outcomes. Mario is especially passionate about cancer prevention and early screening. Ladies and gentlemen, the need is urgent. Cancer is the second leading cause of death in the United States, and the American Cancer Society estimates that more than 2 million cases will be diagnosed this year alone. And the thing about it is that early detection really does save lives. So we're going to have a conversation to learn what we can do to be better prepared to fight this cancer pandemic that we're facing. Hi, Mario. How are you?
I'm doing great. Thank you so much for having me.
Well, thank you for joining me for this conversation.
Right.
Before we talk about the cancer prevention piece, I'm curious, what led you to healthcare?
Healthcare. So when I was young, I know that I wanted to serve my community.
Mm-hmm.
So I went kind of as a young kid, wanting to in the beginning be a firefighter.
Oh, wow.
Right?
Okay.
And then, I someone had introduced me to the profession of nursing.
Mm-hmm.
And when I put them side by side, I saw that the impact that I personally wanted to have in the community fit more with that career path. So I started as a licensed practical nurse and, escalated there to a registered nurse, and, I'm continuing my education even now.
Oh, and worked your way through.
Yeah.
I love what you said about wanting to have impact.
Correct.
Yeah.
Very important.
So that decision to really serve was critical for you in choosing which way to go.
It was. Being able to, again, to make a difference even in individual persons' lives,
Mm-hmm.
right? Guiding them through, I think, a complex healthcare system that we have.
Yeah.
And there's specific, conditions, right? I think it was in understanding the conditions and, and being able to guide them through that, I think was what really got me to want to go through that.
So it's so funny because you talk about firefighter and RN, right?
Yeah.
Typically, a lot of men would have chosen the firefighter route.
Yeah.
You don't see a lot of men choosing to be nurses.
No, I think historically, right, it began with women,
Mm-hmm.
and then throughout the years, men have been integrated into the profession.
I love that.
Yeah, I love it though.
Yeah, and we like to say here in this show that you can do anything, right?
We
You get to
definitely can.
choose a path that feels like true service and true impact to you.
Correct.
And that's what you did.
And the great thing about nursing is everything that you can do.
Mm-hmm.
All the different sectors in healthcare, right, that involve nursing, that has a nursing component to it,
Mm-hmm.
right? That's what got me to it, because I can get bored maybe a little pretty fast. So
Yeah.
from bedside nursing to case management to integrated care to hospice, it's just limitless.
Yeah.
All the different specialties that you can have.
So I know from reading your bio that you've kind of done that. You've gone through working with insurance companies to transitioning now where you're working more directly with patients. What was that transition like for you?
Yeah, so we're talking about cancer, right? And in the beginning, first it was long-term. Let me take a couple of steps back. First it was long-term care, right? I just had a passion for it growing up with my grandmothers. I wanted to give back in that way, and I was drawn to it. Then you kind of burn out, and you also get curious to what else is out there. And then I went towards the case management route, which was fulfilling because I think you're able to have more of an impact, right, in a different way, right? From there, I liked that career path. My father, however, at that point started getting a little ill, and he was actually diagnosed with prostate cancer.
Oh, wow.
Yeah, so I was with him as his caregiver, and alongside my family, my sisters, and my mother, and unfortunately he passed away.
My condolences.
That was a pivotal change for me, right? And that's when I went back to the provider side. and worked for a hospice company as a director, patient care administrator, and then continued to a case manager, which is what I am now.
It's so funny because I also lost somebody to cancer. Early in my career, I actually started out working in fashion in New York. And a good friend of mine was diagnosed with breast cancer. And because of her death, when an opportunity was offered to me to go work for the American Cancer Society to run their breast health partnership, that would have saved her life had we known about the program. I took a $40,000 pay cut and went and sat in a cubicle, and that was the best decision I've ever made. And unfortunately, this thing called cancer is really decimating a lot of lives.
It is, and that's why it's important, to do early screenings. And most important, we have to understand, though, that is a form of screening, not a form of prevention. So we also need to be self-conscious and know, what are we eating, how often are we exercising, right, and trying to live a healthy lifestyle.
Well, let's start with breast cancer. This is October. It's Breast Cancer Awareness Month right now. What are the screening guidelines? What should we as women, and of course, my understanding is that men get breast cancer as well. What should we be paying attention to?
So what I can tell you about all screenings, right? Whether it's the breast cancer through the mammograms, or the colorectal cancer and getting your colonoscopies, or prostate cancer, they have parameters, right? For the mammograms, they say women over 40. For colon cancer and getting your colonoscopy or your stool checked, they say 45, right? For prostate cancer, they'll say 50. However, though, those are the important thing is to really have that conversation with your provider, because there are other factors, right? Risk factors that play key in that. For example, since my father went ahead and had prostate cancer, that puts me at risk.
At a higher risk.
And I've had conversation with my physicians, right, with my providers, and we actually just started, checking my PSA, since last year, right? And I'm 39.
Wow.
Right? So that's, you're talking about 11 years before the actual mandates, before the age that they recommend. Right? So that's why it's important. Family history, genetics, race, right? We know even with our prostate cancer from September, we just passed prostate month, right?
Right.
So that one, the Black community is actually a lot more at risk for that, right? And a lot of that has to do with genetics. A lot of it has to do with late detection, right? But it's important to have that conversation to see what are your risk factors and when should you be actually testing individually for you.
Make sure you're going to the doctor.
Yes.
And you and I work together on the Take Your Loved One to the Doctor campaign.
Yes.
So we'll talk a little bit about that when we come back.
Yeah.
See you in a minute.
Peace begins in the heart. And grows with understanding. Every shared story, and every act of kindness builds a stronger community. In every handshake, smile, and kind word.
Join our movement, Lauderhill. Text Peace365 to 545454 and become a Lauderhill Peacemaker. Pledge your commitment to co-creating a kinder, more peaceful Lauderhill.
You never miss a cut. When the last time you get a checkup?
I used to avoid the doctor, didn't want to hear the bad news.
What do you mean you avoid the doctor? You forgot the doctor, my brother. We teach our boys to take care of what matters. Show up, stay on top of things. But are we really showing them how it's done?
Visit myhealthpledge.org and take the pledge. Then go to the doctor and bring someone with you. No insurance? We can help. myhealthpledge.org lists free screenings in Lauderhill and in Overtown.
Welcome back, everyone. We're here with Mario from Banyan. Mario, you and I just partnered together on a project called Take Your Loved One to the Doctor campaign that we're doing
Yes.
in Overtown and in Lauderhill.
Yes.
And we went out to barber shops and offered some screenings to particularly men in my community.
Yes.
What was that experience like, and what did you notice as a result?
So number one, it was fun, and thank you for
Of course.
allowing us to piggyback in that event, because it was fun. Engaging is always key, right?
Mm-hmm.
And I think in the beginning you might have some people who might be a little
Hesitant,
Hesitant, right.
especially in this climate. Nobody
Yeah.
really wants to talk to strangers because they're afraid that what they might say might put them in jeopardy. Yep,
And I think it's all about the approach.
sure.
All right, it's all about the approach. So if you just go to have a conversation with them, right, instead of trying to push something on them, on anybody, you're more likely to get someone with an open mind, to just talk about how's your day going, right, and especially doing something rather simple than just saying, let me just check your blood pressure,
Yeah,
right, let me check your pulse, and then from there, that is your gateway to a conversation about health and how important it is, for them to get checked out, and then you start asking, some very important questions and engage in conversation. What other what medications are you taking? So you do your regular, medication reconciliation. What history do you have? Any kind of comorbidities? Any diagnoses we should know about? And then the most important one, when was the last time you got checked? When was the last time you saw a doctor?
right.
Right?
And what were you hearing?
That it had been quite a while.
Quite a while for a lot of people.
For a lot of
yeah.
people, if not most. Definitely over 6 months, right?
Wow.
Most of them have not gotten checked so far in this year, in their calendar year.
Mm-hmm.
So being able to have them take that pledge, right? Which I
Yes.
think we got a nice churn out then.
We did.
And
yeah.
and helping them even to come into our Banyan clinic, it was great. You're seeing the impact right there in front of
Right
you.
then and there, yeah. And I was out there with you, and I noticed that, and I even was able to have conversations with
Yeah.
folks that had other challenges besides needing to access healthcare. One lady that I spoke with had an issue with her Social Security and her Medicaid, so we were able to connect her to services.
Correct, and those are some of the benefits that we offer, right, and the services that we offer at Banyan, right, where we have community health workers that are boots in the ground and are out there engaging, people in the
Yeah.
community, and the whole entire point of that is saying, we what is it that's preventing you
From going to the
from
doctor.
going to the doctor,
Yeah.
right? What are your social determinants of health?
Say that again. The
Those-
social determinants of it. Listen, I am
Extremely
obsessed with
important.
that. If in order, and what people don't understand is that only 40% of the health of a community that has anything to do with going to the doctor. The rest of it is your ability to feed your family. The rest of it is your ability to feel safe and connected to your
Correct,
neighbors, have
correct.
great air to breathe.
We all talked about it,
Yeah.
that Maslow's hierarchy of needs. We've all
Correct.
seen it.
Absolutely.
Now the
Absolutely.
important thing is to address it. right?
Address
How are we
it.
addressing
Yeah.
it?
Yeah.
Right, and we do these through proven evidence-based assessments that help us discover and point out what are their main risk factors and how can we provide linkage.
Yes.
All right.
And because we know that early detection leads to a cure, whether it's with cancer, diabetes, hypertension, we have to be vigilant in our communities, especially under-resourced
Yes.
communities where the health disparity is tremendous.
It's tremendous.
Yeah.
Yes, yes.
Well, listen, I'm so grateful for you partnering with us. I'm grateful for Banyan with partnering with us. And one of the things, too, I notice is that you and your team, you in particular, you sometimes do house calls. Talk to me a little bit about that.
Yeah, so two things. So, when my community health workers, right, are able to have some sort of a barrier to engaging a client, a patient of ours, right, or even a potential patient of ours, I go out there with them.
Wow.
I go out there with them. I provide that clinical approach. Again, I've done case management. I've been in communities all over Florida, from the Panhandle all the way to Florida City. So, you got to get out there and engage. You got to get out there and meet them where they're at, right? And I do that. And then also, I'm a per diem hospice case manager. right? And that's
okay.
yeah. So that's a little. That's something from passion, right? Because and what I believe keeps my nursing skills sharpened.
Yeah. I
So
love that.
being able to have your most basic, skills, know how to do vital signs, know how to do basic wound care, and providing education, right? And knowing how to engage, patients in their communities.
Yeah. So in our city, in Lauderhill, we have a community paramedicine team, and I know that they partner with you guys at Banyan and really make sure that our residents are getting the best possible care,
Yes.
particularly those who have those social determinant barriers, as we've been talking about.
Yeah,
All right.
yeah, we've received a few referrals from them,
Good,
and we
good.
get
You have
our
a great
community.
team.
Yes, they
Yeah,
do.
have a great team.
We get our community health workers, and we make sure that they're right out there and are just passing that baton, and that we're continuing where they left off.
Oh, fantastic.
So we're happy. Yeah.
Fantastic. So guys, if you haven't yet had your annual checkup, I really encourage you to take yourself and a loved one to the doctor. If you would like to take the pledge, go to myhealthpledge.org and take the pledge, and then follow up and go to the doctor. We'll be right back.
Yes.
Peace begins in the heart. And grows with understanding. Every shared story and every act of kindness builds a stronger community. In every handshake, smile, and kind word.
Join our movement, Lauderhill. Text Peace 365 to 545454 and become a Lauderhill peacemaker. Pledge your commitment to co-creating a kinder, more peaceful Lauderhill.
You never miss a cut. When the last time you get a checkup?
I used to avoid the doctor, didn't want to hear the bad news.
So you mean you avoid the doctor? You forgot the doctor, my brother. We teach our boys to take care of what matters. Show up, stay on top of things. But are we really showing them how it's done?
Visit myhealthpledge.org and take the pledge. Then go to the doctor and bring someone with you. No insurance? We can help. myhealthpledge.org lists free screenings in Lauderhill and in Overtown.
All right, we're back, everyone. We're sitting here with an RN and a healthcare leader. Thank you for joining us again, Mario.
Yes, ma'am. Thank you.
So we've talked about cancer prevention and how important it is, and we've spoken about your work at Banyan and encouraging people to really get in to see their medical provider.
Yes.
Now, let's talk about you.
Uh-oh.
How do you take care of yourself?
How do I take care of myself? So, in full transparency, I could probably do a little better in taking care of myself.
Okay.
Right? I work long hours, but I love what I do.
Sure.
Right? I get refreshed with my family. I get a reset when I see my children. When I'm
love
with my
that.
wife, when we have family gatherings in the weekend. Once in a while, when I get a pass from my wife, she'll let me go and hit 9 holes or 18 holes in a golf course, and a workout here and there.
Yeah.
But that is an area, being self-critical where I can definitely improve on, especially with exercise, right? And I think
Sure.
that it's a it's a big deal. That's a way of practicing what you preach.
Yes.
That's a way of really addressing your mental health, your stress. So those are goals. I'm not waiting till December 31st.
See, there you go. But you know what? Here's what I believe. I really believe that recognizing it is the first step towards really creating space for you to be better. And I know from personal experience, Mario, that you've got to fill your own cup so that you can give from your overflow.
It's true.
And so thank you so much for being so open and transparent about that.
Well, thank you for provoking thought.
Yeah.
Because I'll be working on that.
Okay, good. We'll have to have you come back to talk about
It'll be a pleasure.
your own journey towards freedom and self-care.
Yes, ma'am.
Yeah. So I'm curious, given what you know as a healthcare provider, as a leader, as a husband and a father, what words of wisdom would you have to offer our community?
When it comes to cancer and early detection, sometimes it could be fear that can prevent you or stopping you from taking that first step. And I would say that it's important to know that, on the other side of that, there's hope. On the other side of that, there's
hope.
warmness, and there's encouragement, and there is support. So it's important to take care of your health. It's important to take control of it, right? And talk to your providers and be there for yourself and for your family and loved ones.
Yeah. Thank you for sharing that.
Yes.
Thank you so much for joining us for this conversation.
Thank you, ma'am. Real pleasure.
So you heard, Mario, there's hope. My encouragement for you today is for you to take charge of your health. If you have not had your annual checkup, do so. I recently lost a very dear friend and colleague to pancreatic cancer. And my encouragement for you is to make sure that you access care now. If you don't have a provider and you need one, every single community have a federally qualified community health center like Banyan. Please take good care of yourself. This has been the Dunn Wisdom Show. I'm your host, Melissa P. Dunn, and I will see you next time.